and it leads to blurry, misty vision and sight loss. It can start in one or both eyes and normally may be happening as a result of aging. That risk is also accentuated in diabetics, persons with diabetes, and it can be treated by replacing the cloudy lens with an artificial one. So it's one of the commonest operations done worldwide, and recent recommendations try to operate at perhaps a speedier rate than is occurring. We usually like to mention a little bit of cricket, and the West Indies cricket team has been thrashing Zimbabwe across there in a 2-test series. I would like to congratulate my friend Junaid, who is one of the stalwarts here at the IBN studio, and the Pakistani team. So he supports the Pakistani team, and they whitewashed their Sri Lankan opponents. I know the West Indies team is also due to play a test series there, as they have had a welcome return to test and international cricket in Pakistan. And speaking of Zimbabwe, the World Health Organization revoked the appointment of their president, Robert Mugabe. So can you believe the WHO appointed him as a goodwill ambassador? We've heard so many negative things about the president across there, so at least in the local and international media. And Zimbabwe has been dogged by a deteriorating health sector, terrifying rates of HIV and AIDS, and a litany of human rights abuses. And they appointed him a goodwill ambassador, so the WHO. But apparently it's been revoked, at least over the last week. And in closing this segment of the show, it's the Medicine Corner. And I'd like to talk a little bit about a burgeoning epidemic. We've spoken about the issues of obesity and diabetes and this whole problem of the metabolic syndrome, inclusive of fat around the tummy, fat in the liver, polycystic ovaries, high blood pressure, high cholesterol. Those are separate epidemics. But an opioid epidemic has started arising in the United States and perhaps creeping into places such as Trinidad and Tobago. US President Trump last week declared that this was a public health emergency. So these are drugs like morphine, pethidine, codeine, so drugs which are traditionally used for pain and sometimes prescribed at levels of the accident and emergency. And this being said that it is now a public health emergency, but opioids like heroin and morphine and so forth, it means that government agencies in the United States will be able to put more resources towards fighting the epidemic. There were 64,000 deaths as a result of opioid use last year. 64,000 deaths in the United States. Now, just say no is one of the things that we would remember. Well, when I was growing up, you would always hear that about drugs, just say no to drugs. But whether or not that too is a simplistic approach to the opioid epidemic, it's difficult as well too in terms of an addiction, because it's a disease when you're addicted to drugs or alcohol, and it involves issues with the brain. Might have been useful in the 1980s, but maybe not to change policy. Some of the critics are actually saying that the president did not make funding available for treating persons who are addicted to things like heroin, and it didn't make one of the antidotes. So if you have an overdose, there's an antidote that can be administered to patients like that, especially if it has affected their breathing and they've slipped into a coma. And some of the funding should be used to address critical needs like the provision of this antidote to hospitals there. There's a strong overlap as well too between mental illness and substance abuse, because it's been said that more than 40% of persons who abuse or misuse substances are also depressed. So that means that treatment should be focusing on both the psychiatric aspect and the physical aspects. Unfortunately, doctors are caught in what was termed on Stat News a moral cage fight. We don't want to feed addiction, so we don't want to be prescribing some of these drugs, but at the same time, we have to alleviate suffering, so we have to try to get some form of pain relief. And I think locally, a classic example is when we see persons with sickle cell And that can be very painful, especially when they get a crisis. They're frequently admitted to accident and emergencies. They come to my ward at San Fernando General Hospital and nationwide, seeking not just pain relief, but relief from the crisis. And sometimes they have infections or they have issues that may have been a trigger for that. And many of them find that they may become addicted to some of these opioids. We sometimes see it even with heart patients. They may find that these drugs which are regulated, these are classified as dangerous drugs. They're strictly regulated in a hospital and even in a private pharmaceutical environment. But it's a reminder about a new epidemic which is arising, a public health emergency in the United States, the abuse and misuse of opioids. Let's have a quick look at this statement from US President Trump.
Effective today, my administration is officially declaring the opioid crisis a national public health emergency under federal law, and why I am directing all executive agencies to use every appropriate emergency authority to fight the opioid crisis. I learned myself. I had a brother, Fred, great guy, best looking guy, best personality, much better than mine. But he had a problem. He had a problem with alcohol. And he would tell me, don't drink, don't drink. He was substantially older, and I listened to him and I respected, but he would constantly tell me, don't drink. He'd also add, don't smoke. But he would say it over and over and over again. And to this day, I've never had a drink. And I have no longing for it. I have no interest in it. To this day, I've never had a cigarette. Don't worry, those are only two of my good things. I don't want to tell you about the bad things. There's plenty of bad things, too. But he really helped me. I had somebody that guided me, and he had a very, very, very tough life because of alcohol, believe me. Very, very tough, tough life. He was a strong guy, but it was a tough, tough thing that he was going through. But I learned because of Fred. I learned. And that's what I think is so important. This was an idea that I had, where if we can teach young people not to take drugs, just not to take them. When I see friends of mine that are having difficulty with not having that drink at dinner, where it's literally almost impossible for them to stop, I say to myself, I can't even understand it. Why would that be difficult? But we understand why it is difficult. The fact is, if we can teach young people and people generally not to start, it's really, really easy not to take them. And I think that's going to end up being our most important thing.
But just to remind today about some of the dangers, and I'm glad that he touched about some of his personal experiences too with his brother and grappling to the curse of alcoholism. Let's take a short break, and when we return, we'll take your calls on Doctor in the House. Stay with us.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
For the everyday lowest prices on all grocery items, trust Low Cost Supermarket for the widest variety of quality products at low prices. Freshly picked fruits and vegetables, healthy products for your well-being, high-quality meat cuts, and a warm and friendly service. Low Cost Supermarket, Southern Main Road, Cunupia.
Reduce the sugar chubby with the same great taste. Lots of magic fruity flavors, drink the more healthy way.
It tastes so yummy, chubby, chubby, yummy.
25% less sugar chubby. Be active, be healthy, drink lots of chubby. Kicking football, playing cricket, having fun in the sun.
It's chubby.
Reduce the sugar chubby, keeps you cool and refreshed.
It tastes so yummy, chubby, chubby, yummy.
25% less sugar chubby. Jumping rope, running races, have fun.
It tastes so yummy, chubby.
Drink the more healthy way.
Welcome back to Doctor in the House. So after a little bit of the negative news, I know that I delved a little bit into some unfortunate stories in the first part of the show, but we usually have a lighter side. And it's just a reminder to us, we move into the feasting time, we move into Christmas, it's just a reminder to be safe in food handling and to be vigilant at the dinner table. Let's have a look.
Excuse me. Are things all right?
No, I do apologize, sir.
It's okay.
Trouble ahead there for Mr. Bean, I'm sure. So it's just a reminder, but what a good clip and a reminder as well too about being careful in terms of food safety, food handling and hygiene. So I'd like to also thank the members of our studio audience here, Mr. Sat Budram, Dr. Neela Ramdas Teelucksingh, and a special guest as well too, Mr. Gangadeen, Randy O'Donnell, who is one of the leaders at CAL, and I would like to welcome him too to the studios of IBN. And Blessings indeed to all members of the family. Birthday greetings to, as I mentioned, my father will celebrate his on November the 19th. And another firm fan, friend and viewer, Dr. Faria Mohammed from Charleville. So the dentist from Charleville there at Sumaria Trace, special hello and happy birthday to you, ma'am. And indeed, Dr. Victor, who is my brother from Chase Village, a close friend and brother almost to us. And he celebrates his on the 30th of October. My good friend too, Mr. Singh from Palki's restaurant, Mishpreet Singh, had his birthday on the 29th of October. And a special hello to Lazina Khan, the Khans from Bank Village, who are also viewers and fans of the show. She always has something to say about the tie or the jacket or so, and she always likes them all, I'm sure. So a special happy birthday and good evening to that family. Right, so the phone lines will soon be opening up. It's the open forum. The theme is healthy lifestyles. This is your chance to call in. So if you'd like to share any thoughts or ideas of a medical nature, we will take a short break. And when we return, the calls will be available. And a reminder too as well that when you're patched into the studio to mute your television set and listen on the telephone when you're patched into the studio, because otherwise you may find that it becomes rather confusing to have a conversation. So we'll take a short break, and when we return, it's the open forum in full flight on Doctor in the House. Stay with us.
At times I feel that the sun is hidden by a hazy sky.
A God's gift brought straight from the farm to your plate. Jazza Rice, with its premium range of basmati rice, helping you prepare your perfect, mouth-watering dishes just as you planned. Jazza Rice, blessings in each plate.
Every now and then we need.
This is a Pakistani product, and all over the world, at least try it once. And if it's good, please let us know. We need your encouragement.
Just a little time to breathe.
Milkana butter, an experience for your taste buds. Smooth, flavor-filled, rich, velvety butter. Milkana butter for cakes, pastries, pies, or just place it in any of your favorite dishes and add that rich buttery taste to all your meals. Why choose another? Look for the butter with flavor, the butter with the creamy richness in taste. Milkana butter. Distributed by N.M. Ghani 2003 Limited, number 1 Industrial Lane, Chamflair.
مولاي صل وسلم دائما 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 مولاي صل وسلم دائما أبدا على حبيبك خير الخلق كلهم مولاي صل وسلم دائما أبدا على حبيبك خير الخلق كلهم محمد سيد الكونين والثقلين محمد سيد الكونين والثقلين محمد سيد الكونين والثقلين والفاري.
Welcome back to Doctor in the House. So it's the open forum. It's your chance to call in and ask some of the medically themed questions. The phone lines should be up on the screen shortly. And so as a reminder to when you're patched into the studio to mute mute the television set and listen on the telephone. So in the interest of time too, we would like you to ask, so I may not be able to have a long chat on the phone because we'll be trying to encompass a lot of questions. I'd like you to ask a question, then you can listen on the television set afterwards. And a reminder as well too that although we're live on Monday nights, there's a rerun on Saturdays at 1 p.m. So you can tell your friends and family members for that. And we are streaming live on the IBN website and on YouTube as well. There is the IBN Master is where you're searching, and you'd be able to get not just this episode, but also past versions of Doctor in the House. So the numbers are 645-4426 or 663-8373. And before we take our first caller, so one of the messages I've had in the last week has been about pre-diabetes. So that has been a creeping epidemic as well. I've been using that term throughout the news. Pre-diabetes, just standing on the threshold of diabetes. And we spoke about that as being one of the issues. It's almost like the tip of the iceberg before someone starts running into issues with their blood sugar. So we'll get back to that because I understand that our first call for the evening is ready from El Dorado. Good evening, and thank you for joining us. Hello?
Hello?
Thank you for joining us, ma'am. You're on the air.
Yes, thank you. What I would like to clear up is a relative of mine, she has severe back pain at the tail of her spine.
Right.
And she said that the doctor said her spine dropped. But I cannot figure out how your spine could drop.
Right.
So could you explain that, or is the doctor misleading her?
Okay, thank you very much for that. Since it's one of the commonest problems that persons may seek medical attention, lower back pain, and there are many reasons for it. In terms of the spine actually dropping, it may be difficult, but to actually say, I don't know if the doctor had the benefit of maybe looking at an X-ray or looking at an MRI. But what can frequently happen in the lower back is there may be wear and tear. So it's an area that tends to take a lot of pressure, and there are often degenerative changes or wear and tear to those bones, the discs. And sometimes they may actually press on a nerve, and the persons may find that that nerve that travels down the leg, the sciatic nerve, may cause a lot of pain radiating from the buttock down to the leg, and it may be associated with numbness, pins and needles, burning and lancing and so forth, and may actually cause weakness. So persons who may be of advancing age, persons who may have had a history of cancer, if they are losing weight, if they have a low blood count, if they have issues where the spinal cord may be compressed, those are individuals who should be sent for scanning, some sort of imaging. And preferably, I would think, if you're thinking about spinal cord issues, you want to do the magnetic resonance imaging, the MRI. That is the best test for that. So lower back pain frequently is due to wear and tear. It may be muscular, it may be due to arthritis. Women, especially after the menopause, may find that they are prone to thin bones, and there may be actually fractures in your back too. And these can subsequently cause not just pain, but also nerve root impingement. So in terms of whether or not the spine will drop, I mean, that's obviously a local term. Perhaps the physician was referring to wear and tear, some of the changes that he noticed. Maybe the bones were starting to get closer, and maybe they were pressing on a nerve, and some of the symptoms were associated with it. But I wish you all the best, though, at least in alleviating that relative's pain. Some of the simple pain relief medications may be used, and of course there are physiotherapy options, surgical options too, and that may fall under the realm sometimes if it's not being adequately addressed by your GP or your primary care physician. It may be referred to a neurosurgeon or a spinal surgeon for further management. Right, so let's take another call. Good evening and welcome to Doctor in the House. Thank you for joining us.
Hi, good evening, Doc.
Thank you for joining us, sir. Welcome. You're on the air.
All right, 2 quick questions.
Sure.
I am taking statins, which is Presto 10 mg.
Okay.
3 times a week, like Monday, Wednesday, Friday. I spoke earlier on about developing type 2 diabetes? How will that affect, that's the 10 mg, how will that affect me?
Okay.
And yes, so that's it. Yeah.
Thank you very much, because I know a lot of persons, in fact, it might be one of the most commonly prescribed drugs nowadays. So statins used in the management of high blood cholesterol, and also used, as we said, to protect your heart and lower your chance for cardiovascular problems. Now, the benefits of statins far outweigh the risks. We often hear persons speak about maybe muscle aches and pains. A lot of individuals have maybe irrational fears about liver damage when it comes to statin use. Many of these would be anecdotal. You've heard from somebody that, oh, you know, you have to be watchful about those drugs. But we are seeing a very real risk for new onset diabetes. But what has been seen in a lot of studies is that higher doses of statins, and that particular brand is called rosuvastatin, so that's the other name for it, rosuvastatin, maybe higher doses, so persons who may be taking, let's say, 40 milligrams per day, because you're on 10 milligrams maybe every other day. Now, that's another issue too, whether or not you're going to maximally get the benefits of statins if you take them every other day is something that maybe is fertile ground for research. So I can't actually say whether or not you're going to benefit from it. It's something, though, to chat with your doctor about as to the reason why he or she has prescribed that statin for you. Because if you're diabetic, so if you've had a heart attack or stroke in the past, so let's say you're 40 to 75 years old with a history of type 2 diabetes, if your low density lipoprotein is more than 190, or if your doctor has deemed you very high risk, you may find that the statin is going to be more beneficial rather than a small chance for harm. But what I would advise is if you're at risk for diabetes, so if you're obese, if you have a family history, you have a sedentary lifestyle, women who have had a history of gestational diabetes, girls with polycystic ovary syndrome, if you've had big babies or sudden unexplained stillbirths, if you have fatty livers, so if you've done an ultrasound and your doctor has mentioned that term, a fatty liver. So that plethora of risk factors for diabetes, it makes sense if you're using a statin to engage in healthy living. So a good diet, low carbs perhaps, you want to avoid the sugars, and as well as exercise, 30 to 60 minutes per day of running, walking, jogging, and so forth. So ensuring that you fight the risk for diabetes. So ensuring that although you may have a predisposition, let's say that you have a genetic predisposition to diabetes, it doesn't mean that you're going to allow genes to run your life. In fact, one of the famous diabetes specialists in the United States used to say that you consider genetics like a loaded gun, but your lifestyle pulls the trigger. And in the same way, if you're using statins, so if your doctor has recommended statins for the management of high blood cholesterol, you want to make sure that you lower that risk, you mitigate that risk for diabetes, especially if you're on high doses. You're still on a very low dose. It's a good statin, it's a good medication. You're on a low dose, and I'm sure you're going to garner some sort of benefit. But there are pros and cons, there are trade-offs to any medication that you're using, and it would be part of your discussion. And I'm so glad that you called in, because it should form a part of your discussion with your physician prior to prescribing a statin. So two excellent questions to open the batting so far on this segment of the show. Let's go back to the phone lines. Good evening and welcome to Doctor in the House. Hello?
Hello?
Hello? Yes, sir.
Yes.
You're on the air. Thank you for joining us.
Yes, I'm calling to find my wife suffers from overactive thyroid.
Right.
And she's been on a medication called Neomercazole 5 mg, which is definitely not available in Trinidad.
Sure.
The thing is, she had relatives who have had their thyroid gland removed.
Yes.
How does that impact on your normal daily living?
Right. Thank you very much.